me, the power of rural is the power of relationship. It's the deep sense of connection that comes from knowing your neighbors, caring for them not just as patients, but as people, and being accountable to a community you see every day. In rural Colorado, healthcare isn't anonymous, it's personal. It's built on trust, ingenuity, and a willingness to step up for one another. The power of rural also reflects our resilience. Rural hospitals often operate with fewer resources, smaller teams, and broader responsibilities. Yet they deliver care that is extraordinary, human, and grounded.
I think that the power of rural means to me, we have to trust our providers, and I feel like we have a very good set of providers right now. They're very loving, very caring, and I feel like that just helps the patients trust them a lot.
I think about the strength, the resilience, and the deep sense of connection that defines our communities. Here in rural Colorado, health isn't just a personal matter, it's a community investment. The well-being of one family, one rancher, one teacher, one child affects all of us here. The health of our region is vital because we drive Colorado's food systems, our energy, our open spaces, and our shared culture. When rural communities are healthy, the entire state is healthier because of it.
We like to take the fact of our rural patients into our decision making all the time. So little things that we think about are how are they getting here to our office in general. So while we do have some patients who are in Brigsdale, Kersey, Keensburg, Fort Morgan, all these places that are further away, we have to think about the fact that sometimes the weather in Greeley is nice, but it might not be that nice in Fort Morgan. And so that might mean it's going to take longer to get here, or they might not be able to make it here at all. And we have to be flexible with those things.
And I'm involved in the community in many facets. I go to city council, county commissioners, and I'm involved in other committees.
As the medical director of Colorado Roots, my work is focused on strengthening the addiction and pain care infrastructure that rural communities have, long deserved but often lacked. We support 16 hospitals across Colorado and Wyoming, providing real-time clinical guidance, training, and evidence-based pathways for opioid stewardship, emergency addiction care, withdrawal management, and everything in between. My role as emergency and addiction medicine physician is to turn evidence into action, helping clinicians feel confident starting buprenorphine and addiction treatment, reducing opioid-related harms, and building referral pathways so patients aren't left to navigate treatment alone. We've created systems where rural providers are no longer isolated, they're connected through warm lines, shared protocols, joint practice dashboards, and peer learning. By expanding access to treatment, promoting stigma-free care, and elevating local champions, we're ensuring that rural communities have the tools and support they need to thrive. In many ways, we're hoping rural hospitals reclaim their power as anchors of health, dignity, and possibility in community.
At AVRMC, we are working every day to move the power of rural forward by expanding access, improving services, and creating programs that meet people where they are. We're seeing incredible work across our community, from local clinics to public health departments who are working tirelessly on prevention and wellness services, schools and educators building healthier futures for our youth, agriculture communities who understand that healthy land and healthy people go hand in hand, and to our nonprofits and community groups who are providing support and connection and resources to all of us, and our innovators and small businesses bringing creative solutions to rural challenges. These organizations and the people behind them are making real impacts on our community and the people in it every single day.
I truly think Jaysha does a lot for the community. She is always willing to help somebody. She's a very amazing provider. All of her patients love her. We get a lot of people wanting to switch to Jaysha because she just cares so deeply about each and every one of her patients. So I think that Jaysha has helped us a lot in that aspect too.
At AVRMC and across our partner organizations, we're working every day to expand access to high quality care right here close to home. That means investing in primary care, emergency services, specialty providers, telehealth, partnering with behavioral health providers, and programs that reach far beyond the walls of this hospital. We're collaborating with local schools, public health agencies, agriculture partners, and community organizations to create a stronger, more educated, and more connected rural Colorado. These partnerships ensure that whether someone needs preventative care, chronic disease management, mental health support, or simply just someone to guide them through the healthcare system, we're here for you.
The authenticity that we have, I think when you go places in the area, you find that everybody's very genuine and helpful and nice and friendly. And everywhere you go, you see hardworking people. So when you go to the grocery store, you see people who are getting off of work. You see construction workers, you see teachers, you see doctors, you see people that you know. And I know for us, when we go out, we see a lot of our patients, and they're always really happy to see us and say hi and things like that. But I feel like when I go out and I see people who are just getting off of work, even though they look tired, everybody's always really nice. And when you're in line at the grocery store, people make conversation with you, they talk to you, they'll let you go in front of them, they let you pass them in the aisle. And I think that there's always still this very small town feel.
Rural communities thrive because they invest in one another. They show up at the school play, at the clinic, at the football and basketball games, and at the bedside. And that spirit of mutual care makes change possible. From the perspective of emergency and addiction medicine, rural communities often outperform their size. They innovate faster, adopt new practices with more unity, and create deeply supportive care environments. What makes these communities a place to thrive is their commitment to dignity and to connection. When someone walks into a rural emergency department with pain, withdrawal, or substance use crisis, they're not met with judgment. They're met with a team that knows them, believes in them, and works together to make sure they get the right care. The landscape also shapes the people. There's a humility, strength, and independence in our neighbors, where we shovel one another's driveways, volunteer for EMS teams that run toward emergencies, and where clinicians wear 5 different hats because the community needs them to. The culture of shared responsibility creates room for not only healing, but for real transformation.
Well, because so I can do things and enjoy life and to be able to be active and be a blessing to others as well.
Health is important to me because when I first started working for this clinic, it was just, to me, in my mind, it was just well checks and sick visits. And what I've learned is that there's so much more to that these patients are coming to us for. They come to us for comfort, they come to us for help with school, the parents come to us for help with getting their social security cards, with getting immigration documentation, getting housing, and things like that. So we're not just here for medical appointments and sick kids and things like that. We really help our patients thrive in the community, and I think that's what's made it more important to me.
So important from what I'm saying is I have come to need several specialists of different kinds, but it was instilled in me at an early age from having this family doctor to the benefits of regular interaction, with the dentist, with the doctor, and then later with a psychotherapist. All that keeps me going and keeps me in the game of life.
For me, health is personal. It's the foundation that allows people to work their land, to raise their families, to support their neighbors, and do the things that they truly love to do. It's what allows our communities not only to survive, but to thrive. When we strengthen health, we strengthen everything else: education, local economies, safety, and quality of life. One of the most powerful things about rural Colorado is that our sense of community isn't just a value here, it's a lifeline.